Hi, and welcome back to the Wellbe Show and podcast. My name is Adrienne Nolan Smith, and I am so excited to have Mark Bertolini with me today. Mark, welcome.
Hi, Adrienne.
Mark is the former CEO of Aetna, one of the largest health insurance companies in the world, until about 2 years ago when he sold the company to CVS. He is currently a retiree enjoying life. And as I read on your bio, I think on Twitter, a rabid hockey fan. Yep. My husband is also a rabid hockey fan for the New York Islanders, which is a very sad losing franchise forever. So I've watched many.
The Islanders.
It's the worst. I think the last time they won, he was born that year. So it's just very sad.
Well, I know the feeling. So I'm really a Detroit Red Wings fan because I grew up in Detroit.
That's what I thought because I knew you were from Michigan.
And so I'm a Ranger fan until the Red Wings show up. And then
okay.
My Terry Sawchuk jersey on, and I'm in Madison Square Garden getting yelled at.
Okay. I was, because some, Michigan fans or Midwestern hockey fans, as I know a lot from my business school friends, that they won't have a secondary team. Like they'll just find the bar to watch the Red Wings or whatever. So it's very open-minded of you to embrace the Rangers as your second team.
My wife, Mari, grew up with the Rangers. So I have, you have to make some sort of.
Oh, yes. There we go. Yeah. I knew there was something else to it. I would love to talk about a million things because you're such a dynamic person with tons of interests, but I'm most excited to talk to you about your experience running Aetna and also your personal health experiences, because when I first heard you talk about them in an interview, it really just struck me because so much of integrative medicine, functional medicine, holistic, and all these different terms for it, but basically just trying to heal root causes of health issues with as natural an approach as possible has largely been, frustrated for years with not getting things covered or feeling like the health insurance system was set up for the medical industrial complex or the conventional healthcare system, whatever you want to call it, and makes it very challenging to get that kind of care. And yet you were, actively learning about it, believing in it, using it. And I just thought that was so interesting. So first of all, I know you had a very serious accident that put you into a coma, almost killed you, as well as a son who was given a deadly cancer diagnosis. So can you share about those experiences and how they led you to be a proponent of a more holistic approach to healing?
Yeah, I think the dawning realization was not so much during the episode or during the hospitalization. So when I was in the hospital with a broken neck and I had terrible neuropathic pain, I was just wondering if I was going to get out of the hospital. Same thing with my son when he was diagnosed with T-cell gamma delta lymphoma. It was, is he going to survive? So it's sort of the immediate reptilian brain kicks in that says, am I going to make it out of this? But once you get out and you realize that what they fixed was the acute event and didn't really prepare you to somehow gather what remained of your life together and to move forward, I realized that how disconnected the system was, how solely focused it was focused on acute issues, and that those acute issues, once solved, really didn't put you back in a place where you could live your life to the fullest extent. You had to figure that out yourself. And so I went on this search first for Eric and then for me around, okay, how do I find a place that eliminates the barriers that my present condition presents in the life I wanted to lead? And that was sort of the dawning moment, is that we as humans don't describe ourselves as, I'm a spinal cord injury patient, or my son's a cancer survivor. He never describes himself that way. He's got huge immunology issues because he's, still on drugs for his cure. I have huge pain issues as a result of my injury. And I look at all the things that I used to do, like playing the piano. I was, trained as a pianist, or riding my motorcycles or riding my bike or playing golf or fly fishing as things that are harder and in some cases impossible for me to do because of my injury. And I want to solve that problem not my injury. I can't fix that. It is what it is, but I want to solve that problem. And nobody's around to help you figure that out but yourself.
My whole platform and my work is dedicated to, I say, empowering people in their health and making sure that, by the end of their experience reading my content, listening to the podcast, working with me one-on-one or taking any of my programs as a patient advocate, that they are themselves a CEO of their health and that they don't need a patient advocate because they are so empowered and they might not have all the resources and tools, but they understand how to find them and what needs to happen. So I very much appreciate that. But it's amazing. You had a long career in the health insurance world before these experiences. Did you utilize any, holistic medicine or natural therapies at all before that?
No, and I can remember sitting in my son's room on the day that he got his infusion of bone marrow from my brother, one of my brothers. It was Good Friday, and a person came in who did Reiki. And she said, "Would you like Reiki?" And he said, "Sure, I'll try anything," because he was, obviously very stressed going through this. He'd been through total body irradiation for the week before. And he had it, and he said, "Wow, that was great." And she said, "Well, would you like to try?" I said, "Sure," because I was literally living in his room with him at the time, and she started doing Reiki on me, and it drove me crazy because she wouldn't touch me. It was sort of like she was waving her hands over me. I found it annoying, quite frankly, and said, "You can stop now. It's not working for me." No, I had used TM, Transcendental Meditation, in college, but I largely did that because I was working full time, going to school full time, and partying full time. And to fit all that in, you needed to find some restorative mechanism that allowed you to be alert, 20 hours a day. So TM gave me that opportunity, but literally Reiki was the first thing I tried since then. And I found it annoying. And I sort of put it on the back shelf until I was trying to solve a year after my accident, when I was on 7 different narcotic medications to control my pain and not feeling any better. It was either kill myself or find a way out. And it was in that journey of finding my way out that I discovered complementary medicine in a more meaningful way.
Yeah, I think I read that the thing that really helped you was craniosacral therapy, which for anybody watching this who isn't familiar, and you are probably, you're more familiar than I am, but it's also sort of a very gentle manipulation that combines some energy work with also structural manipulation. Is that correct?
Yeah, so there's a sheath, a bag, if you will, that goes around your spinal cord and your brain. It's called the dural sheath. And the dural sheath contains cerebral spinal fluid. And that cerebral spinal fluid in healthy individuals flows back and forth in a very gentle way, like a heartbeat. And when I had my injury, I pulled my nerve root. One of the things beyond breaking my neck, I pulled the nerve root for my left arm, one of the big nerve roots, C7, C8, out of my spinal cord, and it ripped my dural sheath and lost most of the use of my left arm. You can see it's a little thinner. And it's now functional today because I've had a lot of surgery to reconnect it. But what was happening is my cerebral spinal fluid was torquing inside my dural sheath. And when I went for craniosacral therapy, the manipulation of the head bones and the sacral bones starts to reestablish that flow back and forth. That's how it works. And it's very gentle manipulation of the brain and sacrum to allow this flow to start to continue it again. I remember somebody saying to me, well, they hold onto your head really lightly and also your sacrum really lightly, and it helps you. And I'm thinking, somebody's gonna hold on my head and my sacrum, I'm gonna feel better, wacky, but maybe I'll try it. And after the 4th visit, I actually started coming off my meds. And a year later, I was off all my meds as a result. And it was just reestablishing this rhythm, because a lot of pain is around lack of sleep and anxiety, particularly your tolerance for pain. And a lack of sleep and anxiety arises from this noise inside your dural sheath about it not flowing gently, sort of like rocking you to sleep or keeping you calm. And so the reptile brain takes over, and your pain spikes because you got the flight or fight response going, and it just cycles and gets worse. This is the very nature of PTSD, quite frankly.
I've thought a lot about and watched a lot of documentaries and read about the alternative medicine or complementary, integrative, whatever we want to call it, movement within the VA and within the US military, and was able to interview a doctor within the military. And they're just the combination of the opioid crisis and the effectiveness they're seeing with using some of, especially acupuncture, but a couple of other ones as well, on these vets and soldiers who were on, like you, 10, 15 different narcotics forever and just kind of feeling so trapped and depressed because of it, very suicidal as well, and eventually being able to come off of these. So the sort of the psychosomatic aspect of pain, I think, is only just like, we're just lifting the veil on it, but I think it'll be just commonplace knowledge, hopefully in, I don't know, a couple decades or something, as we learn.
Lucky for me, I'm not addicted to, I don't have an addictive physiology to opioids. I proved that when, because I was on fentanyl and Dilaudid and OxyContin and all these drugs at the same, Neurontin, Keppra, and all these drugs at the same time, Vicodin, and I didn't get addicted to them. I proved it then, and I proved it when I was in college, when I didn't get addicted either. So, so I was lucky. But
yeah, very lucky.
They get an injury in high school and they get put on something like Vicodin or oxycodone, and all of a sudden they're hooked.
Yeah, it's so fragile at that age too, because they might not even know they have an addictive personality yet, and then it just kind of, it's too late. You had these experiences, especially your accident, which was just unbelievably traumatic. And then you came back to Aetna and were CEO and started making some changes. And I heard about a few of these changes in the interview that I saw of you, but can you describe what those were and whether you got pushback, anything you kind of tried to implement now that you sort of had this realization?
Yeah, when I got off my drugs, I was a person that used to run 4 miles every morning, and I worked out every day. And part of the survival of my accident was the fact that I was in very good shape. I was 184 pounds, 8% body fat. I mean, I was really strong. And so when I got off the drugs and I started feeling better, the next question was, well, how do I engage in activity? And my wife suggested, well, why don't you try yoga? And I said, well, yoga's for girls. And she said, oh, really? And Mari trained with Jessica Char and Krishnamacharya in India, in Madras, when she was in college. And so she took me on the journey to learn about Vinaya Yoga. And I met the head of the American Vinaya Yoga Institute, Gary Krafsow, because Mari was training as a yoga teacher there. And we started on this discussion about what yoga really was. It's about connection. It's about physical poses and breathing connected in a way to allow you to prepare yourself to sit in meditation for an extended period of time. And in that meditation, to understand that we are all connected, we are all one, and that all this noise we have in our head are about attachments. And often people don't meditate because they say it's too noisy, I'm thinking of too many things. Well, all those things you're thinking of are your attachments. And if you have a practice that allows you to recognize those thoughts, acknowledge that they're attachments, and let them go, when you do that every day, over an extended period of time, they go away and you lose your attachments. And therefore you're more present, you're more available to others, and you find this whole pathway. So I'm going through this process with Mari, and I'm reading the Upanishads and the, Pratyabhijna Hridayam and the Bhagavad Gita, and I'm studying, all this Sanskrit stuff. And I go to work one day and I'm meeting with my team, and I say, we should all have our employees do meditation and yoga. And everybody, sitting at the table dutifully said, sure, boss, that's a great idea. Good one. And I get into my office, and almost immediately the chief medical officer follows me in and says, that's crazy, that's voodoo. And I said to Lonnie Reisman, his name, great doctor, great innovator, and he's an entrepreneur. And we had bought his company, and he came along with the company. I said, what does it take, Lonnie, for us to prove this? And he said, we need to do a double-blind study. So we did this double-blind study of yoga and meditation, populations on East Coast, West Coast. I found it interesting that the West Coast people were more stressed than the East Coast people. And we looked at stress based on heart rate variability and cortisol levels, pre and post. And so, 12-week program, Mari designed it, Mari taught the first classes. And like a month after the thing's done, Lonnie walks in my office and says, you won't believe this, it's like amazing. And what we found was that people that were in the highest quintile of stress consumed $2,500 more a year in healthcare than the average employee population, which they were part of the average. And that those rates of stress dropped dramatically, more than half of the people in the program. And what it did is it reduced our healthcare, actually reduced the amount of our healthcare costs, the dollar amount, by 7.5% the next year, because we got these people well again. But Mari brought home some of the the journals for me to read. And I'm reading these journals, and it's talking about people working 2 jobs, families that have to buy Medicaid instead of our own health plan because we charge our employees for dependents, people on food stamps. And I'm going, well, the reason these people are stressed is because of me. And Mari is going, here you are, big shot. And I always swore I was never going to work for the man, and now I'm the man. She goes, hey, big shot, what are you doing to help your employees? I'm teaching these classes. These people are burned out. So I asked my head of HR at the time to look at who these people were. What did the frontline employees' experience of life look like? How much should we pay them? And sure enough, people on food stamps, people on Medicaid, people working 2 jobs, people returning bill collectors' calls at break, and they were making $12, anywhere from $12 to $12.50 an hour. So I started working with the team, and I gave them a copy of Thomas Piketty's book, Capitalism in the 21st Century, about redistribution of wealth as a solution to fixing income inequality and people at the at the lower end of the income spectrum. And I said, this is the solution unless we as the captains of capitalism decide we want to make it different. And through a lot of pushing and shoving and my forbidding spreadsheets after a while, we decided we would raise minimum wage from $12 to $16 an hour, and that for employees who needed health benefits and were under 300% of the federal poverty level, we would wipe out their healthcare costs if they engaged in wellness and with our programs. And I remember flying to Jacksonville to make a big announcement. People thought I was going to sell the company or something, or I was retiring. And I walked into the room and told them, we're going to do this for you. And it was the most amazing experience. It gets even gets me emotional today. It was 2015, and it was the most amazing experience. I mean, free hugs, people, in letters afterwards where, I finally can send my kids to college. I don't have to call bill collectors on break time. Thank you so much. And what it did is it did 2 things. It helped all those employees, but more profoundly, among CEOs, it changed a lot. Because they called me and said, what are you doing? And I said, well, if we're going to fix this problem, we can't wait for Washington to solve it, because we know Washington can't work. It doesn't work. So instead of waiting as corporations to get permission from Washington, what we need to do as people, as leaders, is make the change and then turn to Washington and say, here's how you can help us make this better. Now, I'm far more disappointed in what's happened since then, quite frankly. I think, with this last tax cut, CEOs embarrassed all CEOs like me by, taking the tax cuts and doing the largest share buyback in American history instead of enriching people's lives that needed it. So I'm not happy with that. And I even mentioned that in my book. But this idea gave my employees, my leadership team, permission to bring more ideas. And so a whole cascade: double tuition reimbursement, repay student loans, create PTO banks for people, paid time off banks for people when I didn't use mine, I put it in the PTO bank. Other people could use it if they had family hardships. Help our foundation helping families that were in trouble, moving our people out of harm's way during hurricanes, or major disasters and into hotels, including their family and their pets, so they would be safe. All that stuff just sort of happened. Pet therapy in all of our buildings. And the only time, and people would line up down the hall to go pet dogs and rabbits and cats and gerbils. I said no to mini ponies. That's the only time I said no to mini ponies. But so all of a sudden was this huge cultural shift in the company that is impossible to measure from an economic standpoint.
Yeah, that's very interesting. I mean, you were so lucky to be able to have the measurement of the yoga and meditation study. Most places implement something like that, but don't implement the study to prove it. And it ends up getting kind of cut as soon as the budgets get a little tighter and stuff like that. So I really appreciate that you did that. And I wonder, after you did that, if the company then thought, would this bring down our members' healthcare costs as well if we covered yoga and meditation apps and classes and stuff? Because traditionally those things have not been covered by health insurance. Was there any conversations about that?
We did. We actually offered it. We created a website called aetnasocialcompact.com. I wanted to call it social contract, but the attorneys didn't like that word. So we called it aetnasocialcompact.com to show CEOs about how we did the analysis, the decision-making, what kind of metrics we collected so they could do it themselves. And I did a lot of phone calls with CEOs and said, okay, tell me how you did that again and the kind of things you did. The issue with yoga and meditation, the meditation was easy because we could do that with computer-based models for everybody. The yoga was harder because it had space to do it. And they needed really well-trained yoga teachers to do it, particularly the kind of yoga we were doing. I mean, we were doing direct from India kind of yoga, stuff that goes on in these weekend classes. And so there are yoga teachers and then there are teachers. And getting the right number of yoga teachers, like from the American Vinaya Yoga Institute, was hard. We didn't have enough of them around the country. So we were limited in that regard.
Yeah, that's such a tricky part about, traditionally health insurance. If you cover an MD, they all go to different schools and there's some good ones and bad ones, but generally, they're an MD. Whereas very cheap, gym fitness yoga classes are completely different from, the kind of experience that you had studying yoga. So it's like when you cover that, you don't really know the quality and therefore how that relates to the outcome. But it's great to know that you tried that. So on that topic, very few natural, functional, integrative medicine doctors are covered by the big insurance companies. And those doctors are, they usually don't even take insurance because the insurance model is just so very different from how they practice as far as these longer appointments and spending much more time with the patient and not always having an outcome like writing a script or referring to a procedure, but just, learning, talking, going through their lifestyle. How do you think we can solve this problem? Because it really is the major barrier to people accessing a more holistic approach to their healthcare, especially for people that don't have disposable income. And what do you think really needs to happen to shift the paradigm of holistic medicine being like this luxury, fancy, rich people thing?
Yeah, I think the biggest problem we have is state-based licensing and regulation on providers. Because I use a naturopath. A naturopath in New York cannot bill as a provider. They can ask for cash, but they can't bill a claim. And they're not considered part of a medical provider, even though they're licensed in the state of New York. So you have different regulations depending on where you live. And as you know, from living in the greater New York metroplex, borders are, all over the place. You got Jersey, you got Connecticut, you got New York. And so solving that problem on a national basis and saying, here's what a licensed provider can do and cannot do, regardless of state lines, is incredibly important. It's going to become more important when you get into super specialized care, where you have providers, particularly with 5G coming along. And I sit on the the Verizon board. With 5G coming along, remote medicine is going to be more popular, as we learned in the pandemic. Right? You don't need a doctor anymore. I mean, for some things you do, but others you don't. That's one point. The second point is when you price all of that in, what are the premiums? But there's a point that most people don't understand, that they don't think of when they go to one of these providers. We all have HSA or HRA plans, most of us, or FSA plans. All those funds can be used to pay for those providers. And it's a wallet we don't know about. Often we don't even know what's in there because it's not readily available. And so those, you can easily do it, and you can easily do it on the spot with the cards they have now. But most people don't
this has been my number one recommendation to people for as long as I've been doing this, is to, max out their HSAs, and you can carry it on year after year. You can pass it on to a loved one when you die. You can invest that money. Like, I just think it's fantastic. And, but it only comes with, high deductible health plans usually, which I realize for some,
what we have today. But it's
right.
The majority of what we have today.
Right. Yeah. But some people push back against me saying like, well, I can't afford to have a high deductible health plan. And I say, I get it. And so what I dream of, and you can tell me how unrealistic this is just that all of healthcare is an HSA account, and there's no submitting and getting reimbursed or denied or this and that. You just have the card. If it's, if you're able to pay for it through the card, great. Everything goes through there. It's your money. So I think there's more accountability and responsibility as well there. And there's broader use across many kinds of medicine, the way that it is today with naturopathic physicians and acupuncture and things like that. So is that a pipe dream? Is that ever going to be?
No, it's not. Actually, you can do that today.
How?
So on Amazon, in their payment section, you can actually add your HSA and FSA cards.
Okay.
And if you do anything on Amazon that would apply to that payment mechanism, they'll prompt you and say, do you know you can pay with this with your HSA card?
I did not. I will be doing that tonight.
Do it tonight. I mean, it's brilliant. I mean, they're opening up a whole new wallet for Americans. So you can do that on Amazon today.
Yeah. And I use it, at a CVS or Walgreens or something if I know that, but it's very, this is like kind of what I do for a living. So I've looked at all of the things that are covered, and I know they change year to year. But I think most people don't look at those lists. Like, they don't realize that sunscreen is covered, but Band-Aids aren't, or, whatever.
Supplements are covered.
Yeah. Oh yeah. There's lots of great stuff that's covered.
Massage is covered.
Oh yeah.
Covered.
I use mine all the time. I use mine for supplements. I use it for all kinds of things. So, but I also realized that, that's not for it. A lot of people aren't realizing that that's an option. And so I think it's about awareness and education, but it's also about hopefully getting things streamlined where that's all your healthcare. You don't have to worry also about your plan and whether you have this or that, and within it, you just use that. So anyway, I dream about that. I
think the relegation of insurance to the back room. So I view a world where we have the conversation about the investment, right? When you go to buy a car, you can't go to General Motors and buy a car. You can't go to GMAC, the financing arm, and buy a car. They don't sell them. You have to go to the dealership, and you have to describe your ambition for transportation. I want this kind of car with this kind of seats, convertible or not, or I want it to be electric, or whatever it is you want it to be. And once you decide it, what your investment's going to be, what kind of ambition you have for transportation, then you say, how much does that cost? And once you figure out how it's going to cost, then you decide how to pay for it. I'm going to do a trade-in. I'm going to borrow money. I'm going to pay cash. That's the only way to buy a car today. That's why buying cars has become so easy, because there's no margin in cars anymore because people buy cars that way. So what if we bought healthcare that way? What if we said, my ambition for my health is to eliminate my pain so I can ride my bicycle more often, go fly fishing, and play the piano again? And if you can figure out a plan to help me do that, I want to invest in that. Because this is the issue around engagement. If we say to people, you're a diabetic, and that the best way for you to look is like the cover of Men's Fitness or Women's Fitness magazine, because that's healthy, most people throw their hands up and go, ain't going to happen for me. And you don't motivate them. But if you say to them, that pedal neuropathy that you have, that what don't you like about that? Well, I can't go for a walk, or I can't run, or I can't walk over to the senior center to go play cards. You say, but if we get your diabetes under control, we can get those feet better so you can do that again. Are you interested? Sure, I'll do that. And so once we figure out what that plan is, then say, okay, now how do you want to finance it? And in the back of the room, we've got Medicare, we got Medicaid, we got all these other commercial health plans. We'll give you a quote on all of them. You pick the one that suits you best.
Yeah, and I think the quote on what suits you best, but also what that actually encompasses is so important. That stood out to me, what you just said, because you talked about something similar in the interview that I watched, and I just want to call it out. So the Democrats are obviously now in charge of the White House and both houses of Congress. So I think we could see some major legislative changes in the next 2 to 4 years. Right. Medicare for All is considered one of the, left solutions to lowering healthcare costs. And I know that from the interview that you said you aligned left, but I heard that you said about Medicare for All that refinancing this kind of broken system, which is excellent for acute care, but not really for chronic care, which is the majority of our costs, is not going to solve the problem, right? It's just kind of moving the deck chairs around on the Titanic or something like that is the analogy I've heard. So I agree with that. That's always made sense to me when people mention that to me and ask me my thoughts on it. I say, that's the financing is a problem, but way before that, way upstream is the main problem, which is that we're not looking at the root causes of these health issues and solving them from the bottom up. So what would you tell President Biden to do tomorrow from whatever he could do from a policy perspective to try to fix not only our healthcare costs, but, maybe go a bit upstream and see what he can do there?
What's actually happening in Medicare today, Medicare Advantage? What we figured out in Medicare Advantage is that if we actually invest in the individual social determinants of health, we'll have a much greater impact on their costs. They'll have better survey scores. We'll meet all their HEDIS indicators. And the way the system's set up, our star ratings will go up, and we'll get 5% more in revenue to take care of them. And so, that's the model. The average Medicare person spends 120 hours in the healthcare system every year. That is less than 95% of their waking hours, or less than 6% of their waking hours. So for 95% of our waking hours, we're in the world. And the doctor never has a clear picture of what's going on in the world because they're not connected to that. They see you in the office. And they'll say, how's the diet going? Or how's the exercise going? And they're looking at you and they know it's not going well, but you're going to say, you know what, great. Right? And they'll look at tests and they'll say, well, your tests are bad. But they'll never sit down and say, how's the stress of your life going? How's your relationships? Are you sleeping well? All those sorts of things. Very few doctors do that.
Oh, yeah.
In that understanding that you come up with these issues about how to better take care of someone. So I will argue that providing people with support for food, transportation, heat, and socialization, seniors particularly in their home, is less than 2 ER visits a year. That's a better investment, actually. And so what we need to do is fix that stuff, because the federal government, if it's paying for all of it, in my opinion, doesn't really matter. It doesn't fix anything. And as a matter of fact, when Medicare was started, the first financial intermediary, the company that set up all the systems, all the payment mechanisms, all the eligibility systems, was a company called Aetna. I had the first Medicare check on my wall in my office at Aetna for $571.17 paid to Hartford Hospital in January 1965. So the insurance industry has always run that. The insurance industry runs Medicare Advantage. The insurance industry still runs Medicare. United is one of the biggest providers of Parts A through whatever, F. And the insurance industry runs Medicaid. The only time it wasn't run was for the ACA, and that was a disaster coming out of the box. So you still need this public-private partnership to make it work. So if we're just going to refinance a broken system, then it's just going to cost us more. And I don't know that the US government is a really good purveyor of good financing of effective, efficient systems. And so that's where the issue is. It's in that dialogue. People throw out Medicare for all. Well, let's talk about it. You know, who runs the Medicare system today? Who runs the Medicaid system today? They say, well, your Medicare costs so much less to administer it. Who does that? Well, we do it. The industry does it. But there's only 4 plans. That's why it's so cheap.
Yeah. And I've been told, I mean, you know a lot more about this than I do, that a lot of the private payer patients for health insurance companies are really making up the difference of a lot of their Medicare and Medicaid members or beneficiaries. So it's actually the government involvement in setting those prices, which throws everybody else's prices so out of whack, which is interesting. You know, I think some government involvement is good in certain things, but it's funny when they get involved in a system that used to be a perfect market. This is just kind of nerding out a little bit with my business school hat on, but supply was the doctors and the healthcare providers. Demand was the patient, consumer, whatever. It's no longer even close to that because the payer is somebody else. So people don't know what things cost. They would be a lot more scrutinizing if they did up front before they committed to a new doctor, procedure, or whatever. And so I don't know what the answer is because I believe that health insurance is useful. But I do know that a perfect market would get the prices more in line with what they should be.
We need to have a different conversation. So what we need to say to people is when you need follow-up for your care or you're worried about your health, come and talk to us and let's have this conversation that says, what is it about your health that gets in the way of the life you want to lead? And then let's put together that plan. So you may be you remember triptychs? You may be too young for triptychs. But AAA used to make these maps for people that wanted to go on vacation. So you went to AAA and you didn't say, where do I go on vacation? You went to AAA and say, I want to go to the Grand Canyon. We're going to drive. And how do I get there? And what they would do is give you these flip book of maps with a yellow highlighted route. And then they would orange circle all the attractions along the way, the mystery stop, Paul Bunyan and his ox babe and his big axe, the fudge stores, all that stuff. And they give you guidebooks for all of those orange circled items. And you bring it home in a bag and you put it on the table and say, here's our trip to the Grand Canyon. We're going to drive. And here are all the places we can go. Where do you want to go? That was called a trip ticket. What if we built that for healthcare? Where do you want to go? What are we solving for here? You want to walk to the senior center again? Okay, how do we get your diabetes under control? Here's your pathway. Here are all the things you need to know about it. And once we figure that out, let's find the cheapest possible way to pay for it. And so insurance goes to the back of the dealership, to the back of the store, where it's just used to pay it, and you shop for the most effective financing. And that's what insurance companies ultimately will become.
Yeah, I believe in that. And I think for somebody like me, I care deeply about health freedom and being able to, make my own choices about the kinds of providers I'd like to see and, not say like, I'm going to do this because it's covered, but just have that flexibility and freedom. And so, it makes sense for me to have a very low, sort of acute emergency only type of, hit by a car type of thing. And the rest of it, like, leave it up to me. I care deeply. I research a lot. I believe I can make good decisions. So that's a very different need from somebody who really isn't empowered in their health and really isn't engaged and might have a lot of chronic health issues and wants to just kind of have everything taken care of by their health insurance and go through the process that way. And to think that we should all have the same answer is totally incorrect. So I think your custom trip idea is good.
Well, I think then you put doctors at their highest use and based on their skill sets. So it's, cognitive skills and the laying out of hands versus, where do we get your lab filled out? What pharmacy do you belong to? That should be a whole other concierge system that works around it. And I think the patient-centered medical home model is a really good model with the doctor as a quarterback or as the big thinker versus the doctor trying to figure out which pharmacy you need to go to.
Right. Yeah. The administrative side of healthcare is very cumbersome, and putting it on the doctor who really just wants to be the care provider it's a bad use of their skills. And also, I think it really burns them out. So we're in this chronic disease epidemic, right? And as you said, like the American system is pretty broken. We have the lowest health outcomes of the 34 OECD nations. Life expectancy has been going down the last couple of years for the first time in, I think, like 40 years or something. It's the most expensive system per capita in the world. And so given the stuff that you use in your own life, the, naturopathic physicians, as well as all of your experience in the health insurance world, what role do you see, health insurance in general playing to get us out of this chronic disease crisis? I know you mentioned a few things already about what you think would help, but, just how do we go from this broken system to one that, really works for people?
Well, one of the reasons we did the CVS deal is I think standalone insurance as a mechanism to help solve healthcare's problems is not going to work, right? It's financing a bad investment. So, no matter how much money you have, if you buy a bad car, it's a bad car. No matter if you got the money cheap or you saved your life for it, it's a bad car. And so, we keep trying to perfume the pig here by financing the system differently. It's not going to work. That's why I think value-based contracts aren't going to work either over the long run. If you've seen one value-based contract, you've seen one value-based contract. So the issue really needs to be, let's make it about the person. Let's build the system around them. Let's support them with services in the community nearer their home. I was in the hospital in March. I got out, I needed a shower chair for a couple of days because I've been in the ICU for 9 days and I couldn't stand that long. At the local DME, my shower chair was $250. On Amazon, it was $35 delivered to my door. Same chair. So, but people don't do that. They don't think, well, I'll buy a shower chair from Amazon. That's a great idea. And they'll deliver it to me. And so if you think about that, just the arbitrage on buying better and thinking smarter and doing things that are relative to me and my circumstances in my home and in my community, I think there's a more robust economy around health and caregiving that could emerge where we spend more money there than we do in the medical industrial complex and building bigger and shinier buildings with more machines that go beep. Take a line from Monty Python.
Yes. I was my life before Wellbe was in health tech. Actually, I worked with hospitals, and I actually worked on the DISRIP program, if you are familiar with that, back in sort of, like you said, it was a lot of social determinants for health. And I think it was a good program.
You were a health systems planner, right?
I was on the technology company side. So I worked with my hospital clients to see how our technology solutions could help them meet the DISRIP program goals, which a lot of which were, trying to get people with chronic disease to stop coming to the hospital, know. But of course, there were such perverse incentives. Like they wanted them to come on day 31 because that was fine. Right. But not day 30. I was just like, oh my God. And so I think I got pretty disillusioned. And also it had my own experiences. I lost my mom to suicide, and I had chronic Lyme disease and stuff. So I saw a lot of parts of the healthcare system. And when I healed my own health issues through a natural approach, and just from really understanding what was going on in my body and, taking out certain foods and using herbs, I didn't understand how powerful herbs could be. It kind of changed my perspective on what we should be doing to help people with chronic conditions, and certainly the gut brain connection and things like that, and realizing after the fact how many other health issues were under the surface for my mother, but it was that kind of boiled up into this mental illness. But really, there was thyroid, there was childhood trauma, there was parasites, there was all this other stuff, and I thought, God, I wish there had been somebody that gathered the pieces and saw, peeled the onion back before she had this major manic episode, because it was years and years in the making. And so that's really, leaving healthcare, conventional healthcare technology, and starting this was really born out of that passion to help people see and bring a lot of research and statistics and brilliant minds like yourself into the fold, because I was sort of sick of hearing that it was just, quackery and not science and this and that. And then and reading so much research myself and saying, well, what is that then? That's research, like that's science. That was my path. So what would you say, as us consumers, us patients, what can we do to make our voices heard and advocate for this more health freedom, or trying to get this more holistic medicine into the conventional system? And from your experience, even though I know that healthcare financing isn't going to lead that charge or shouldn't lead that charge.
I think first of all, you need to understand what problem you're trying to solve. And so that, that requires a little personal awareness. It requires introspection into what you're willing to do. As a result of all the surgeries I've had, I have limitations because of my broken neck. And so every time I stretch them and I break something else, my doctors are getting tired of putting me back together. I've had probably 7 or 8 surgeries in the last 14 years, 16 years since I had my original accident, because it's the way I want to live my life. And so I always say to them, I had a fractured humerus at one point from an accident I had, and because I don't have good control of my left arm, and the doctor said to me, we're going to have to fix it. I said, well, I'm an inch short on the left side of my right calipers because this arm is contracted. Could you give me an extra inch in the bone while you're putting the arm back together? And so you have to have this sort of sense of what it is you want out of life. Versus, one of my first initial, the thing's not usable all that well, I might just cut it off. And so this whole idea, what's valuable to me as a person around my health? What about my health is getting in the way of the life I want to lead? That will then steer you toward the kind of people you should go see. I work with an integrated cardiologist who listens to my heart, but doesn't make me take all my clothes off and do an exam. We have a conversation. She's amazing. And we sit and talk about lifestyle, childhood. Was I raised on a bottle or not? All those sorts of things. And all of that matters. And so when you have a conversation with a person like that, you're wondering, why am I doing that? And in the end, it's because it's valuable to me and people understanding who I am and what I need. You have to do that homework first, and then go into the system to find the people to help you do it. Then you can look at your HSA and your benefits and say, how can I get access to that kind of care and afford it?
I think so many people look to health insurance to solve the problems instead of looking inside themselves to know what they want out of life and therefore what they want from their health. And also having a come to Jesus moment with themselves to say, I always say, the 100 choices that you make a day are your true healthcare. Like, right. How many of those 100 choices do you think actually improve your health versus detract from it? And when people can honestly say, I think most of mine are, making me healthier, then they're on the path. But, a lot of people just don't want to deal with it, don't want to think about it, don't want to confront their own, kind of lack of self-love, lack of self-compassion to take the time to move enough, make nourishing food, go shopping for nourishing food in, places that have it, do those things that, once you care enough about your body, you'll do. But before that, you may not.
The single biggest problem as an American public is insulin resistance. It drives inflammation. It drives heart problems. It creates huge obesity. It's a driver of obesity across America. When you think about things like corn syrup and everything, corn and everything, insulin resistance is a really big problem. And people don't know they have it until it's often too late. It's showing up in diabetes type 2. And the sacrifices required to address with insulin resistance, which I have, is, 30 grams of carbs a day versus 180. That's recommended by the average daily diet. Not 2 scotches every night. It's a different world. But if I want to have the level of acuity, activity, and enjoy the life the way I want to enjoy it, those are the sacrifices I need to make. But you never get there unless you understand what your issue is.
I think the major leap of understanding what your issues are and also the life you want and how you feel about yourself, like it's all that stuff, people just shut it off. They don't want to go there. They want someone else to deal with it usually because it can be painful, I think.
Or take a pill.
Or take
Right? If I take my cholesterol lowering drug and my metformin, wow, I can just eat chips and drink all day long. Soda.
Right, exactly. It's a miracle. I'm sure there's nothing happening on the other side of that. It's a miracle. Actually, speaking of insulin resistance in food, I know that you were instrumental when you were at Aetna in getting the Aetna Foundation to support Wholesome Wave, which was a program that gave families on meal assistance and food stamps, farmers market vouchers. Can you ever see a world where that's a possibility for members of health insurance companies like Aetna or any others?
I think social determinant support by health plans is an important thing to do. And there's a plan out here in California in San Diego called SCAN that is what's called a social HMO or a SHMO that says we'll pay for anything that makes you well and prevents you from using the system. We'll cover it all, diapers, transportation, whatever. And those kinds of models are good models. People have to be willing to work within them and use them effectively. You need, you need this personal awareness, self-awareness, this different sort of mindset in order to work in that system.
Yeah.
Yeah, I agree. They're great models.
I know how much food can act as either medicine or poison. And so I always wonder why we aren't starting there as far as financing. If somebody is on Medicare or Medicaid or even their private insurance, they know if enough double-blind studies are done, they'll see it saves, a dramatic amount of healthcare costs in the system. But it's just so hard.
But if you look at all the food pyramid and you look at all the recommended daily allowance for Americans, it's still too high in carbs.
Oh yeah, and sugar and
sugar.
Yeah.
And why is that? I mean, all the double-blind studies in the world have been done around lowering carb intake and sugar intake. And why haven't we dealt with it?
Yeah, I think it's called industry. I think lobbying is very powerful.
Bingo.
Money talks. I know I've taken up a ton of your time. It's just so interesting. I could probably talk to you for 6 hours about all this stuff. But I'll ask you one more question before I let you go. So we're in the age of COVID, right? COVID-19 has shown us just how important our overall health is when it comes to our ability to combat the virus. I had COVID in November, and I was actually surprised how mild my experience was. I did have a symptom. I had a fever the first night. And after that, I just kind of had like a stuffy nose. I didn't even lose my sense of taste or smell, and wasn't really tired or anything. And it was just so dramatically different for me as, versus other people. And you hear such a spectrum. But I had been making 3 meals a day for myself with pretty much only organic food since March, when we all were kind of, quarantined, or rather just, living at home, working at home. And I take a lot of supplements that we now know are very important for COVID, vitamin D and glutathione. I take regularly just as a gut health boost, but It turns out that it can be for COVID treatment actually, and was in a New York Post article that I read, life-saving treatment for somebody who was on a respirator. But the point is, the cost difference between a healthy person getting COVID and a sick person, being in the ICU for weeks or months is outrageous. I mean, it's just outrageous. Do you think COVID will be sort of a wake-up call or a driver for healthcare financing companies or insurance companies to expand coverage to these more sort of nutritional building and sort of lifestyle support things like supplements and healthy food that we know are having an impact on people's health before they get COVID, and then obviously how they recover from it?
No.
Oh, darn.
And the reason is the vaccine is going to save everybody from it. And if you ever thought if you could design a bug that was particularly useful in destroying the US economy, this is it. Let's introduce a bug that goes after a heavily comorbid population that has huge levels of obesity and bad habits, particularly our individual freedoms, and no personal responsibility. And a vaccine comes along and goes, I got the vaccine. I mean, the vaccine right now, getting a vaccine, getting an appointment for a vaccine is just like getting tickets to Hamilton. Woohoo!
Yeah. Everybody that I know is just celebrating. It's like they're off the hook. They don't have to take care of themselves. It's like,
so anything that can absolve us of personal accountability. And the problem is that all of this stuff, if you look at all of medical science and all it's done over the years, the magic bullet mentality is going to prevent us from addressing the root causes. If you look at all the medical science over time, the biggest advances have been around issues of public health, clean water, hand washing, the germ theory, all those sorts of things, sewers, all those sorts of things. And if you look at the rest of medical science, it's actually detracted from life expectancy. I would argue that this dismissal of all these public health programs like mask wearing and hand washing and, not, social distancing in a time till we find a solution and people just rejecting it out of hand is our biggest problem.
Yeah.
It's real science. I don't like wearing a mask. I hate wearing a mask. I don't like not having to go to a restaurant and sit at a bar and have a nice drink. But you know what? I can't do it because I'm putting other people at risk or I'm putting myself at risk. And if you want to brag that you got, you're a tough guy and you can live through COVID, great, go ahead, do that. But don't get anybody else sick. Because I've had friends who have had it and said, "Yeah, I'm fine." How many people did you get sick while you were walking around with that disease?
Yeah, no, that's definitely the scariest part. And you have no idea because every body reacts so differently, how that other person or their body will handle it. And I think the mask wearing is just such an easy, like, if that helps, why is it a big deal? I'm fine with it. I just wish that the public health officials today were not only saying wear your mask and social distancing, but we're also saying, if you're vitamin D deficient, find out immediately, get a supplement. Like, we know this matters. Or if you have comorbidities, you better get on a regimen and a diet ASAP to make sure that you don't end up in a hospital. But that's not what's being communicated.
Well, I think we have a very big problem with hopelessness in this country. And that's a key driver behind people not taking care of themselves. And it's a key driver of the opioid epidemic. I'm giving up. Lack of labor mobility. I'm hanging with the Klan. And we did this work with IDEO and understanding health front to back and reinventing the customer experience as part of our preparation for the CVS deal. And in that discussion, there was a lot of discussion with people who said, you know what, I know I'm fat. I know I got diabetes. I'm retired. I just want to enjoy myself before I go.
Yeah.
It's a fatalism. And I think that kind of attitude really works against really taking care of ourselves. Then you have the other end of the spectrum, which is the transhumanist movement and the people in the Longevity Institute who want to live forever. And, I'm not quite sure I want to live forever. I don't know about you.
No, it's, I see a point where I'm going to say, like, this was fun. I think I'm ready. I want to be in great health until that day.
There's a great article about James Fries, Fries, in 1972 about squaring out the morbidity curve. And he did a study that looked at, organ reserve and at, whatever medical science was at the time. And his comment was, 85 is about the best you can do where your organ systems, start to fail. And so wouldn't it be great if you were perfectly healthy until the morning of your 85th birthday, had a huge breakfast, and you were dead by noon? Wouldn't that be great?
Yeah, that's kind of around I say I want to live to 91, so I get to my 60th wedding anniversary. That's my goal.
Great.
Anyway, thank you so much for this. I know I've kept you longer than I told you originally, and I appreciate your time. It's such an honor to pick your brain and get to hear all your thoughts from all of your experiences, both personal and professional, on healthcare financing, what it's really going to take to, get us out of this chronic disease epidemic, and really what we can do as Americans to fix this system that kind of broke around us without our consent, without us realizing it. And we want to help our fellow people. There's a lot of people who are so sick and have been for so long on so many drugs and spend so much time in these procedures and just in the system, when we can see most of the stuff is so avoidable, both with the social determinants of health and just with this personal accountability, responsibility to say, I'm going to take care of myself every day. I'm going to eat right. I'm going to figure out those things that I need from the healthcare system and use them. But otherwise, I'm on my own. Like I'm my own doctor in a way, the buck stops with me. So I love that we agree on that. And I really appreciate everything that you were able to share. So thank you again for being on the show.
Great talking with you.